How do you know if you're a candidate for pain management therapies? The first thing is to go see your doctor or other healthcare provider, and they'll make sure that you've done the appropriate things for your condition, including rest, ice, elevation, over-the-counter anti-inflammatories, physiotherapy, or other physical treatments. If those things aren't working in a reasonable time frame, an injection or other image-guided procedure may be appropriate for you. So there are three important phases or steps for patients who are receiving pain management therapies through Canada Diagnostic Centres. The first one starts at your doctor's office or other health provider, where they evaluate you and create a working diagnosis about what the pain generator is, what your problem is. That may include us as well at that stage in terms of getting medical imaging tests such as an ultrasound or an X-ray to help determine the problem. The second step is the procedure itself, performed at a Canada Diagnostic Centre, where we use precise image guidance to deliver an injection or other therapy into the joint or other body tissue or structure that we believe is causing your pain. The third phase, very important, is rehabilitation afterwards. In general, we think that patients should wait 5 to 7 days for the injection or other treatment to begin working. After that, you can start to pursue the physiotherapy and increase your strength, mobility, and stability. That will help prevent the need for another injection or other treatment down the road. We think it's very important that the patients do have continued care after they've seen us to make sure that they have the best results possible.